Our next speaker is Dr. Matthew Pase, who is a relatively new addition to the Florey and the University of Melbourne. He is currently a Heart Foundation Fellow, Future Leader Fellowship, which is the most prestigious fellowship that the Heart Foundation award, and a Senior Research Fellow at the Florey and Swinburne University. So what hasn't been captured is that Matt's just done some fantastic work when he was working on the Framingham project for 3.5 years. And he was in fact a media superstar. Apparently he was on Dr. Phil and was one of the most highly tweeted and discussed people with his work particularly about sleep, which when I first met him, he's very unassuming, he wouldn't have told me any of that. I had to find that out later. His work is focusing on elucidating risk factors for Alzheimer's disease, dementia, cerebrovascular disease and cognitive impairment. And he's going to talk to us about vascular risk factors at younger ages most strongly associate with brain volume. Thank you, Matthew.
Thanks. Thanks, Amy, for the invitation to present. Okay, so we know that vascular risk factors are associated with poorer neurological outcomes in old age, such as high risk of dementia, brain atrophy. And there's some evidence to suggest that this association might be highly age-dependent. But it's sort of hard to make inferences by comparing different cohorts because of the different population characteristics, etc. But it's important to clarify when vascular risk factors might have the biggest impact on brain atrophy, risk of dementia, because clarifying target populations where we can have the biggest impact with interventions is obviously going to be important for having the biggest impact in terms of reducing dementia burden. We've seen in our cohorts at Framingham some evidence to suggest that vascular risk factors are more important at younger ages. Now, Framingham Heart Study involves a number of ongoing prospective cohorts in the town of Framingham of Massachusetts, and these different cohorts that we have different mean ages. So if we just take one of our cohorts that has a mean age of 42 years and look at the impact of hypertension, say on total brain volume or a cognitive outcome, we see that hypertension explains around 7 years of brain aging. Whereas if we take an older cohort, a cohort that's got a mean age of 20 years higher, we see that hypertension only explains around 2 years of brain aging. And so with these findings and findings from other cohorts, we thought it was important to systematically investigate age-dependent impacts of vascular risk on brain health. And so that's what we did in this study here. And for this, we know that vascular risk factors tend to cluster together. As Yen showed, risk factors don't occur in isolation. And so rather than look at hypertension or diabetes, we created an index which combines different vascular risk factors together. So we looked at the Framingham stroke risk profile, which is a validated algorithm that predicts a 10-year risk of stroke. And it pulls together information on age, sex, current smoking, prevalent cardiovascular disease, atrial fibrillation, hypertension treatment, diabetes, and systolic blood pressure. And we related this information to brain volume on MRI, and we used brain volume as a sort of surrogate for overall brain health. And as I said, our cohort included participants from the Framingham Heart Study, so we looked across a number of cohorts. And this study really has two components. There's a cross-sectional component and a prospective component. So for the cross-sectional component, all we did was we took our index of vascular risk factor burden and related it to brain volume, and then stratified results by each age decade, from people aged 45 to 54, right through to 85 to 94. The second component was prospective. So what we did was we leveraged up to 40 years of longitudinal data to ask how vascular risk factors in the past relate to current brain volume. So to give you an example, if someone came into our clinic at age 85 and provided a brain MRI, because they've been enrolled in the Framingham Heart Study for 40, 50 years, we're able to look back at our data and say, well, how did their vascular risk factors at different points in time in their life relate to their brain volume that we see today? And these are not vascular risk factors that are estimated retrospectively. These are things that were measured at the time by physicians. And we have quite a large sample size, so for the prospective component, there are almost 8,000 observations. So these are the results of the cross-sectional analysis. So what you're looking at is the strength of association between overall vascular risk factor burden and brain volume, stratified by each age decade. So the point estimates are beta values, and then you've got standard errors around the beta values. And lower scores indicate a stronger negative association between vascular risk and brain volume, so high vascular risk, lower brain volume. And the first thing you notice when you look at the figure is that it doesn't matter at what age you look at, high vascular risk is associated with lower brain volumes. But the second thing to note is that association is highly age dependent, and you can see that it's strongest in people in the 4th and 5th decade of life. And if you fit a linear line to that, there is a linear association there that's quite strong. So vascular risk factors more strongly associating with brain volume at younger ages. So next we looked at the prospective data, and this is put into age bins. So for example, we look separately at people who provided a brain MRI at age 55, 65, 75, etc. So this figure just shows data for people who provided a brain MRI at age of 55. And what it shows is the estimate between the vascular risk factors and brain volume at age 55 and the vascular risk factors at 45 compared to the brain MRI at 55. And what you can see is that when we look at their vascular risk factors 10 years earlier, they more strongly predict the brain volume that we see on the MRI today. When we look at people who provide a brain MRI at age 65, we see more or less the same thing. The vascular risk factors at that time do predict lower brain volume, but actually the vascular risk factors 20 years ago better predict the brain volume that we see today. And there's a strong linear trend there. We see the same thing when we look at people who provide a brain MRI at age 75, and then again at 85, and again a strong linear trend. So now we're looking 40 years back. So if someone came into the clinic today and we took a brain MRI, we took their vascular risk factors, those vascular risk factors would associate with their brain volume, but actually the vascular risk factors 40 years ago would be more informative. So just to sort of summarize this evidence, we think that perhaps vascular risk factors at earlier ages might be indicative of sort of advanced biological aging. In other words, it's not uncommon for people to have clusters of high vascular risk factors later in life. It's quite common, whereas someone who's, say, 45 and presents with a high vascular risk factor burden, biologically is probably quite advanced in terms of their age. We know that in old age, it's common for multiple pathologies to co-occur, so you can get Alzheimer's disease occurring with vascular pathology, and perhaps other pathologies are overshadowing the impact of vascular risk factors. And I think most importantly, past vascular risk factor burden catches some element of cumulative exposure. So if we think in the absence of a clinical stroke, vascular risk factors are likely having an insidious effect on the brain, causing the slow accumulation of pathology. And so if someone's been living with hypertension, diabetes for 40 years, that's a lot more time for basically pathology in the brain to accumulate. And obviously it's important to note that our data has an element of survival bias, so those participants with high vascular risk are more likely to die prematurely through other things like MI. So we think that obviously this data is observational, so we can't infer causality, but we know that vascular risk factors do associate with cerebrovascular disease pathology, and their treatment does reduce risk of stroke. So our data has a number of implications, and we think that studies using cross-sectional data or short follow-up periods might underestimate the true association between vascular risk factors and different aspects of brain health. So if you imagine some studies, say, focusing on Alzheimer's disease, they recruit a cohort that are age 75 plus, they exclude people with stroke and things like that at baseline, and they look at differential impacts of vascular disease and Alzheimer's disease on brain outcomes, and you might conclude that vascular risk factors have minimal impact, but without considering the whole lifespan, you might be missing a lot of information. Our data suggests or underscores the importance of limiting and treating vascular risk factors earlier in life, from the 4th to 5th decade, and perhaps earlier. And our data suggests that past vascular risk factors might be important for evaluating risk of vascular cognitive impairment. And likewise, current risk profiles could be used for the purposes of risk stratification for future vascular cognitive impairment. Just after we published our paper, this came out in a European Heart Journal, and it shows quite similar findings. So what you're looking at is the relationship between systolic blood pressure and risk of dementia, and you've got 3 graphs by age. So the graph on the left shows systolic blood pressure at age 50, in the middle at age 60, and on the right at age 70. And you can see that having high systolic hypertension at age 50 predicts risk of dementia in old age, whereas having high systolic blood pressures at age 60 or 70 do not. And this is data from a colleague at Framingham, Emma McGrath, and she looked at dynamic changes in systolic hypertension throughout the lifespan and how they relate to risk of dementia. And she found that having high systolic blood pressure in midlife was associated with around a 70% increase in risk of dementia. In contrast, having systolic hypertension in later life was associated with around a 48% increase in risk of dementia. But perhaps most strikingly, having persistent hypertension, so hypertension that was evident in midlife and persisted through to old age, was associated with over a doubling of risk of dementia. And this association, though, is quite complex because when they looked at individuals who were normotensive at baseline, what they found was that decreases in blood pressure over time, so a decline in the slope of blood pressure, was associated with a higher risk of dementia. So hypertension wasn't good for the brain, but then again, some evidence to suggest that declining blood pressure into old age also was detrimental. So to summarize, vascular risk factors in the 4th and 5th decade of life appear to be important for overall brain health. And as the brain is an end organ of vascular disease, these data underscore the importance of limiting or treating and just looking after your vascular health from an early age to preserve the brain with aging. I'd just like to thank my colleagues. This work wouldn't have been possible without the team at Framingham, in particular Sudo Seshadri, Alexa Breiser, and for this paper in particular, Charlie DeCarli. So thank you very much.
And this will be of great interest to Vladimir, who often speaks about hypertension and the effects on the brain. He's giving a series of talks over the next week, so I'm sure that he'll be speaking about this. I think that really brings a point that we need to be interacting with the hypertensionologists. I remember hearing some similar work done a few years ago, but in hypertension, talking about that decline at a World Congress of Cardiology, nothing to do with brains.